But you have something really, really interesting that you're doing for your patients. You've actually developed a free application, Help My Diabetes app. You can go download it. Anybody can download it, right? Can you kind of
Right.
give me, break it down for us? What, for you, what encouraged you to develop an application for patients to really learn, and what does the application do?
Yeah, so over the past few years in my practice, I noticed that the best person to take care of diabetes would be someone who know the patient or who know you very well and also know diabetes very well. The problem is most doctors know diabetes well, but they don't know their patients so well. At the same time, the patients know themselves very well, better than anyone else, but they may not know diabetes very well. So the question is, how can we find someone who know both parts very well? Is it possible for a physician to know patients very well? And I think that's very difficult in today's environment because physicians have to see maybe hundreds or thousands of people, and we only have maybe 10, 20 minutes or at most 1 hour for a patient, and we only see them once every few weeks or once every few months. So we won't be able to know all the details of their lives, and life is ever changing. One day you may need to attend a wedding, next day you may be in stress, next day you may decide to do more exercise. So life is ever changing, and all those changes in life can affect the blood glucose or blood sugar control. And there is serious consequence when the doctor don't know patients very well. For example, one of my patients, she came in and she told me that her blood sugar has been running very high, and she took 20 units of insulin every day. So I told her that uh, then you can take 30 units of insulin every day because your blood sugar has been running high. And then a few days later, I got a phone call from the hospital that she's hospitalized for low blood sugar. So
Really?
it turned out that she had a stomach flu and she has not been able to eat much over the past few days. And then the blood sugar tanked. So if I knew this earlier, then I wouldn't give, if I had been able to predict that, I wouldn't give her such a cookie cutter recommendation. I would tell her that you have to decide on your insulin dose based on how much you eat instead of using a fixed dose every time. Um,
Right.
that's a problem when the physician don't know the patients that well on a day-to-day basis, then the patients can get into serious problem. So the question is it possible for patients to know diabetes well? And my answer is yes, if they are equipped with the right tool. And that's the reason I developed this application called Help My Diabetes. So in this application, so the problem, why people find it difficult to learn diabetes well is because the information online, when they find on the internet, are either unreliable or inconsistent or overwhelming.
Right.
So
Absolutely.
that's a problem. So I have to give people reliable information based on scientific evidence. And I need to give people a small amount of each information each time, small chunk of information each time. So people don't feel overwhelmed because nobody has time to read over 1,000 words or 300 pages each time. And most important is I have to show people how to I should not only give people fish directly, but I need to show people how to fish because everyone prefers different kind of fish. So not only telling people what to do, but also tell people what's the rationale behind it, what's the reason why you need to do that. So I think that's what distinguishes this application from the information that you can find on the internet.
Right. So you're giving them your knowledge at the palm of their hands, right?
Right. And it's all problem-based, all the information there. Because if you go online, if you go to read a medical textbook, it will be a large chunk of words without addressing your problems. But I have gathered the most frequently asked questions by my patients over the years and try to respond to those questions on what to do, what you should do in those scenarios. So all the informations and answers are problem based.
Right. So in your practice, what have been the most common questions that you've heard from patients that you're trying to that you're solving with the application?
Uh-huh. So let me give you a few examples. For example, that sometimes people said my blood sugar is low at night. Should I still take my Lantus or Levemir? That's one kind of question. Or I'm going to have surgery tomorrow. How should I change my insulin dose since I will fast overnight? Or some people ask me, my diabetes is better now, my blood sugar is better. Can I stop one of the medications?
Oh, right. So within the application, you're answering those questions. Like, so somebody who's, improving their health, numbers are improving, how would you deal with something like that kind of a situation?
Right. So I think in that kind of situation, you need to see how good are the numbers. If the blood sugar already trending too low, then you need to stop one of the medications so the blood sugar does not get too low. However, if the blood sugar is perfectly normal, then probably you shouldn't stop any of the medication unless it's giving you side effects. Because most likely, if you stop one of the medication, then the blood sugar will bounce back up.
Right. So it depends on how active they're doing, how consistent they are. It sounds like.
That's
Dep-
right.
right, right. Cool. So, when you're working with your patients, Chi, um, what outside of the time that you see them? 'Cause you said, you see them maybe every 3 months or every 6 months or every couple of weeks. With that my help my diabetes, have you seen an improvement with some of the patients that are using it?
Oh, yeah, definitely. Uh, People find they have more control of their lives because they have basically a system to help them make day-to-day decision on their diabetes care. So I see my patients more satisfied or happier with their diabetes care, and they are less likely to go into hospital because of high blood sugar, and overall get a better blood sugar control and take less medications.
Yeah, I mean it's almost like you're there all the time for them, or they have information that they don't have to guess. Or the one thing that um, Google's a hell of a drug, man. Like Google's crazy because you can search something and you can get good information, and you can get horrible information. And some people don't know how to decipher between which one's good or which is bad. So they're taking a risk with their life depending on where they get their information for their diabetes care online. If say they never came to you outside of those times where they came into the clinic and you maybe decreased or increased their insulin or gave them some other information,
Mhm.
that time in between that, if they're going onto Google and going to I don't know, some whack job website that's telling them to do all these things, for their diet, or you can still have candy. That's fine. Just do X, Y, and Z, and then they're putting their life at risk if they're going to trust that information. But with that help my diabetes, it's trusted information from an endocrinologist that's been doing it, and they don't have to guess if it's good or bad information.
Right. So the problem with Google is, first of all, the information or the answer you get there are inconsistent or conflicting with each other. So it's
Yeah.
hard for you to make a decision. And second is Google doesn't really know what kind of problem people need to address. So when you have a real problem, you do not always find the answer from Google. And third, when you find information on Google, typically it just tell you what to do, but they don't tell you why you need to do that. So you are not able to apply the information in a flexible way according to your own situation. You are forced to use a cookie cutter suggestion.
Right. A cookie cutter solution to a complex problem.
That's
That's
correct.
different for everybody. My diabetes care will be different than yours, different from somebody else's. And just going online and doing one simple thing is, um, it may be okay for prevention for someone who's not diabetic, right? But
Yeah.
if you're diabetic, you have to stick to what your doctors are saying you and your behavioral support specialist, whether it be a health coach or a dietitian or nutritionist that's going along with you in this journey.
Mhm.
um, that plan matters. Do you
Yeah.
work with a lot of outside providers with your patients? Like, I mean, I know we kind of talked about your clinic has health coaches, but are there who's a part of your care team when you're working with a diabetic?
Yes, I also work with diabetes educator. I work with dietitian, um, and I also work closely with primary care physician as well.
Right, right. Yeah, I mean, it takes a team, especially for with patients. What are some of the when you're working with a patient, what are some of the simplest things that people can do to better their care, but they're not doing that you've
You
noticed?
mean what the patients can do to better their care, or what the physicians can do or providers can do?
Oh, let's start there with what can a provider do to better assist their patient?
Yeah, so I feel that the providers need to help people learn more about diabetes, so they will have a better control of their care. What people are doing now is because of time limits, they just rush through the patients in 10 or 20 minutes and give them a few instructions, maybe adding a few medications, and that's it. And sometimes you may have seen people who, providers or doctors, who just blame the patient, saying that you are not adherent with your diet or you're not taking your medications, um, and then dismiss the patient's concern or complaint. That's all manifestation of the time constraints. So I think for providers or for physicians, they need to spend more time to help people learn about their conditions and give people more power over their care.
Yeah, I agree with you. I mean, there is a lot of that, and I understand. Doctors they have, as their schedules are crazy. They make that 20 minutes. They're trying to get so much done. Something's going to get missed. It's inevitable. Something is going to get missed or not taken care of. But it's a two-way street. You know what I mean? The patient, with the people that I see, they have to. Some people just don't take accountability for
Mhm.
what they're doing,
Yeah.
or they don't. So they don't have they're not educated. They don't know what they
Uh-huh.
have to do,
Yeah.
or they say that they're doing everything right, but
Yeah.
are they being truthful? I mean, who knows? They can say, "Hey, I don't eat none of that. I don't eat none of that." When they just got done eating everything they said they didn't eat before they came to see me. You know what I mean? Those things probably happen. So, I
Yeah.
mean, I think it is an interesting dance between provider and patient.
Uh-huh.
But what helps is having
Yeah.
other people in between there. So,
Right.
endocrinologists that can do your part that you're good at and you specialize in, and then having a coach. Do you do you feel like the communication between providers can kind of be an issue as well? Like if you have a patient and like the communication between primary care and the diabetic specialist or endocrinologist, those things kind of that communication barrier. Do you feel like that's an issue?
Yes, it is. Because the primary care doctor or different providers on the same team may work in different healthcare system or different hospitals. And unfortunately, most of those different healthcare systems or their computer records do not crosstalk with each other. So it's very difficult for us to get information from other medical system. And then there will be a breakdown of communication because of that.
Yeah, which can be a problem for because the patient doesn't always know what's going on with themselves. You know what I mean? They don't always know what their medications are, how many units of insulin are supposed to be taken at what time, or what happened in one hospital. I mean, they don't often know, so that communication can be tricky. You
Yeah.
Can be very tricky. So what is your hope with Help My Diabetes? Like what are you trying to accomplish? You have it, it's free for anybody to use. You know,
Mhm.
what would you like to see happen with it?
Uh-huh. Yeah, so I provide four types of information on the app on the Help My Diabetes application. First one is the medical knowledge to help you make medical decision at home. The second is cooking demonstration to give you more ideas of what you can eat at home. Because I know that diets or what to eat or foods can be very limiting for people with diabetes. And the third is I provide you information on where to get medications or testing supplies at a lower price, so how to save money. Uh, and I also talk about, and in the app, it also gives you information about the injection technique. For example, how to inject insulin, how to put on a continuous glucose monitor, or how to inject different other types of medications. So what I would like to do with the application is to return or give the power of your life, give the control of your life back to the patients, so uh, they don't have to follow a cookie cutter or a one size fits all instruction because one size does not fit all.
Absolutely. I love that, man. Giving that power back to the patient is so important. And I don't think that's in the at the forefront of, I'm not just saying doctors. I don't think that's even in the forefront of the patient's mind of being of understanding that, hey, understanding your disease and taking control of it can give you power to put back into your life.
Right.
You know what I mean? You take control of that, you know, it you can do so much more.
Mm-hmm. Yeah, diabetes is a freedom limiting disease, I would say. And then we want to give you the freedom back.
Absolutely, absolutely. If someone wanted to talk to you or learn more about your app, where can they find some information?
Yes, so I have a Facebook page, Help My Diabetes Facebook page, where you can post your questions or you can send email to me.